Ankle brachial index introduction. Ankle brachial index is non-invasive and inexpensive method used to diagnose and detect the severity of peripheral arterial disease. ABI is the most frequently performed test using Doppler ultrasound and cuff. The ankle brachial index is measured by dividing the ankle systolic pressure by brachial systolic pressure. ABI is equal to highest systolic ankle blood pressure divided by highest systolic brachial blood pressure. Contraindications: breaking of thrombus, severe leg pain, and DVT. Indications: peripheral arterial disease. Peripheral arterial disease is reduction in arterial blood flow to the limbs during walking causing pain. Risk factors: diabetes, smoking, history of tobacco use, and atherosclerosis. Procedure of ABI: tools, handheld Doppler or handheld ultrasound or stethoscope, inflated cuff. Preparation: avoid smoking, rest for minute before measurements. Loose comfortable cloth will be a better choice for easily wearing the inflated cuff on upper arm. Supported comfortable position and avoid limb movements during measurements. Technique: the patient is in rested position. It is better to measure the brachial pressure before the ankle pressure. Place the cuff around the arm or use of handheld ultrasound device and pressed against the skin at the level of brachial artery in arm. Repeat on other side and record highest measurements. Place the cuff around lower leg at two levels. First, dorsalis pedis. It is located between tibialis anterior and extensor hallucis longus. Second, posterior tibial pulse. That is behind medial malleolus. Record the highest pulse between dorsalis pedis and posterior tibial artery. The ABI calculated by dividing the highest value of ankle systolic pressure between two arteries by the highest brachial pressure between two sides. Repeat on other side. Interpretation of ABI, ABI ranges and possible indications. Greater than 1.2 indicated falsely elevated arterial disease and diabetes. 0.95 to 1.19 indicated normal. 0.75 to 0.94 indicated mild arterial disease and intermittent claudication. 0.50 to 0.75 indicated moderate arterial disease and rest pain. Less than 50 indicated severe arterial disease. Hello everyone, we are going to present ankle brachial index. Procedure: for brachial systolic pressure, equipment, stethoscope, sphygmomanometer and Doppler ultrasound. Instead of Doppler ultrasound, we are using stethoscope. Patient position: relaxed quiet sitting position. Therapist position: next to patient chair. Upper extremity is free of clothing and place the cuff around the arm. Ensure mercury level in manometer. Now locate and palpate brachial artery as it is lies on the medial side of the upper part of the arm, medial to median nerve and lateral to ulnar nerve. Place the diaphragm over located brachial artery. Close valve of BP cuff and rapidly inflated the cuff approximately 30 mmHg above estimated systolic pressure. Release valve carefully and allowing air out slowly. Listen through the stethoscope and watch the manometer. Note the point of first sound. It is your brachial systolic pressure. Same procedure repeat on other upper extremity and noted measurements. Record highest value of blood pressure among bilateral upper extremity. Now we are going to perform ankle systolic pressure. For ankle systolic pressure, patient position relaxed and quiet supine position. Therapist position, sitting, place the chair next to patient table. Place the cuff around lower leg. Now place the diaphragm at the dorsalis pedis, which is located between tibialis anterior and extensor hallucis longus muscle. Same procedure is repeated for measuring ankle systolic pressure by taking reference as dorsalis pedis artery. Note the measurement. For posterior tibial artery, now place the cuff around lower leg. Place the diaphragm at posterior tibial artery that is behind medial malleolus. Same procedure is repeated for measuring ankle systolic pressure by taking reference as posterior tibial artery. Note the measurement. Now we are calculating the ABI. ABI is equal to highest systolic ankle blood pressure divided by highest systolic brachial blood pressure. In our patient, we have to select the highest value from two measured brachial blood pressure. Highest systolic brachial blood pressure is 104 mmHg. Highest systolic ankle blood pressure for dorsalis pedis artery is 102 mmHg. Highest systolic ankle blood pressure for posterior tibial artery is 102 mmHg. Calculation for dorsalis pedis artery, ABI is equal to 102 mmHg divided by 104 mmHg is 1.9, which is normal. For posterior tibial artery, ABI is equal to 102 mmHg divided by 104 mmHg is equal to 0.9, which is normal.